Hey everybody, this is Dr. Oob to go over the second part of this video about why do I have high blood pressure. The follow-up video is called How to Naturally Treat High Blood Pressure. So I've left the diagram for the first video, and if you haven't seen the first video, we'll go over the diagram. I'll put a reference to it in the comments. But basically today I'm going to be going over how to naturally treat blood pressure. We've already discussed how to treat it with medications and how the medications work. I did erase some of it off the diagram. But now I'm going to go through some of the things that you might want to try to naturally reduce blood pressure. Because to remind you from the first video, if you have high blood pressure, that's a symptom of something else going wrong, and you have to figure out what that something else is in order to reduce your blood pressure naturally. Inevitably, we're not supposed to have high blood pressure. So if you do, something is causing it, and it may not be one thing, it may be multiple of these things that are going to reduce it overall, and then you won't have the problem. So it may not be any one as a home run. You might have to do everything on this list. Now, we could talk about this for hours. My videos I do typically ramble on and on. So I'm going to try to keep it succinct, and you guys are welcome to ask more pointed questions and comments if you want to, and I'll do my best to answer it on social media. So let's start off. I've written the list in brown over here on the corner in order to maintain the chart. And so the first one is nitric oxide. That is arguably the most important thing in reducing high blood pressure. But figuring out what is preventing the nitric oxide is a little harder. So you may not know what nitric oxide is. It's not nitrous oxide, which powers supercars and whatnot. This is nitric oxide. Nitric oxide is actually made by the inside of the artery. So the artery has three layers to it, and the internal layer called the endothelium, which is arguably one of the largest organs in the body. It used to be the skin, now we say the endothelium. This endothelium lines the inside of every artery. And in fact, when arteries get so small that they turn into capillaries, which is one cell thick, it's endothelium only. This endothelium produces a hormone called nitric oxide. Nitric oxide dilates the blood vessel and opens it up so more blood can come in. So for instance, if you're running and you're exercising your legs are going to be releasing more and more nitric oxide to dilate the arteries in order to bring more blood to it. So as we discussed in the first video, one of the reasons to have high blood pressure is the artery is compressing. It's got too much tone, it's too strong, and it's compressing. That's raising the blood pressure naturally. So if you can raise the nitric oxide, then you lower the blood pressure overall. There's a few ways to raise nitric oxide. It's actually gotten fairly popular in the past few years. Beets is one of the main ways to raise nitric oxide. It turns out that it's got the components in order to raise nitric oxide. So there's plenty of products out there with beet juice and beet this and beet that. It doesn't matter. Eat the beets, drink the beets, however you get the beets in you. Be careful if you're consuming the juices and things because you can get a bit more sugar from those. They are called sugar beets after all. Neo 40 or Human N has made the product Neo 40. Human N is the company. They made the product Neo 40. It's a tablet of proprietary beet stuff. And they've shown with research that their product boosts nitric oxide. So that's one of the things we frequently use in our practice. They also make the Beet Elite, the athletic drinks, and those seem to work really well for athletes. So boosting your nitric oxide is important. Use beets. The other one that I actually recently learned about was sunlight. One of the concerns of why our vitamin D levels are low, but replacing vitamin D alone doesn't actually have the benefit that we would like. One of the concerns or things we've discovered in research is actually sunlight stimulates the skin to make nitric oxide, which raises your total nitric oxide levels. So by getting more sunlight, you might be able to reduce your blood pressure. This also might explain why darker skinned individuals, African Americans, actually have higher blood pressure levels and suffer from high blood pressure more often. Could be related to the sunlight because their skin is breaking down the sunlight before it reaches them. And of course, no smoking. That's just a no-brainer these days. If you're smoking, that's raising your blood pressure. The carcinogens, the nicotine, all of it is raising your blood pressure, so quit smoking. And then I wrote no alcohol. It's not necessarily no alcohol. It depends on where you're at in your health journey. Of course, the more alcohol you consume, the more inflammatory, poor detox, blah, blah, blah. That's going to cause high blood pressure. So limit your alcohol intake, especially if you're trying to figure out what you need to do to reduce your blood pressure. And then once that works, then you can start adding more back in to a reasonable amount in order to maintain your blood pressure. Number 2 on my list is magnesium, and this I tried to put some organization to as far as priority, but it's almost impossible to prioritize this because if magnesium is your big issue, then that is your number 1. So for magnesium, I aim for serum levels of 2.2 or greater in all my patients, no matter where you are. Serum level is really easy to check. It's just a blood level. Any general practitioner can draw your serum level. You don't need to get fancy and do an RBC level, just a generic serum level. I want over 2.2. If you are not over 2.2, then I always ask my patients to supplement. Magnesium is one of those weird elements that our kidneys inappropriately dump in times of stress and inflammation and anything else. The kidneys accidentally dump too much, so we have to replace more of it in order to maintain our levels until we can fix the underlying cause that's causing the kidneys to actually dump too much magnesium. So keeping your serum level over 2.2, and sometimes it takes a lot of magnesium to do that. As Dr. Sidney Baker, who's in his 80s or 90s now, says, you cannot overdose on magnesium, you just poop your pants. So if you have high blood pressure and you're worried your magnesium is low, just keep increasing the dose until you get liquid stools or soft stools and you realize you've kind of gone too high. Your bowels can only absorb so much. Our preferred magnesium in our office is magnesium glycinate, which usually comes around 120 milligram pills. We frequently start people at 2 pills, but some people have to go up to 8 or 10 per day just to maintain their magnesium levels. You know your body needs magnesium when you can get to pretty high levels and not get any diarrhea or loose stools. It's because your body is mopping it up. If you're not mopping it up or if you're not absorbing it, that's when you're more likely causing diarrhea. It doesn't necessarily mean you don't need the magnesium, it just means you're not able to absorb enough of it. But if you don't get the diarrhea, that definitely means you needed it. There's other magnesiums out there. I encourage anyone to use any magnesium version that they like or can find, but I'm not a big fan of magnesium oxide. Do not use magnesium oxide. It just doesn't seem to work. I don't like it. And that's the one you find the most commonly at regular CVS and Walgreens and stuff. Those are pretty terrible versions of magnesium. If you're not sure if your magnesium is high quality or not, just take a bunch. And if you get liquid stool, then it's probably a good magnesium. If you don't get liquid stool, then throw it away. Try a different one. The next on my list is CoQ10. There's actually some good research. The Cleveland Heart Panel actually shows it on their panels, that if your CoQ10 level is over 1.7, it actually shows some antihypertensive or blood pressure lowering effects. CoQ10, there's a lot of drama and marketing around CoQ10. I'm not a big believer. I don't care whether it's CoQ10, ubiquinol, or whatever they want to call it. CoQ10 is CoQ10. It's mainly found in animal sources, so your CoQ10 needs to come from an animal source. If you don't want to take a supplement, you can eat liver. If you're into that kind of thing. Liver is pretty high in CoQ10, so you can eat liver to raise your CoQ10 levels. This is not an easy level to draw from the lab. You can do it through Cleveland Heart Lab and certain other labs, but just know that the CoQ10 level, if it's not treated properly or drawn by someone that's used to doing the CoQ10, you can get some funny results on that one. But in general, aiming for over 1.7 seems to be beneficial for pretty much anyone, but certainly if you have high blood pressure, going to higher levels can reduce it. Whatever version of CoQ10 you decide to take, if you can check a serum level and you're over 1.7, it's considered winning. We use the generic CoQ10 from Orthomolecular. I usually recommend the 300 milligram capsules, the higher dose ones. I'll tell people to take it every day for a couple months and then stop, and then we'll check the levels at 3 or 4 months. And the reason why is because CoQ10 is fat soluble, so it accumulates in the system. And so if they take it for 2 months and it raises the level and then they stop for a while and it lowers the level, then that kind of tells you that they need a daily dose of it. It doesn't really tell you if they were actually able to raise their level at all, but in general, their level should be at least somewhat higher than before. So if someone drops their level or doesn't get high enough after the 2 months of 300 milligrams, then I'll tell them to take it either every day or they can take it every other day because it's fat soluble. It's not one you have to take every day generally unless you're not absorbing it well and need that dose. From what I know, it's really impossible to overdose on CoQ10. I haven't heard of anyone overdosing on CoQ10. You just get red, oily stool if you take too much and don't absorb it. Number 4 on the list is arguably number 1, but I just didn't make it number 1. It's anti-inflammation. So inflammation is probably the number 1 cause of high blood pressure that's out there, but inflammation has numerous causes. So figuring out what's causing inflammation in you is one of the most important things. It's almost always related to nutrition and gut health. So right under anti-inflammation, I change the diet. You got to decrease the sugar in order to reduce the yeast and fungus overgrowth, and you've got to increase the fat because humans are meant to survive mostly on fat, not on carbs and sugar. Too many people lump sugar into just candy and sugary sources, cookies and treats and all that, but we cannot forget that breads and pastas, potatoes are all carb sources, and your body doesn't care whether it's a Snickers bar or a potato, it's sugar. Sugar is sugar. So there's no dressing it up as far as complex carbs and, oh, a potato's healthier than a candy bar. No, sugar is sugar to the body. If you have high blood pressure, you want to be reducing the inflammation by decreasing the sugar and increasing the fat. You don't necessarily have to get all ketogenic, although that may help you with high blood pressure, but you should at least be reducing the sugar, increasing the fat. The next things you can do for anti-inflammation, as far as in the supplement world, you can do curcumin. That's very well known, very well studied, has numerous benefits around the body, and once again, you can't really overdose on it. We usually recommend a 500 milligram twice a day. You want to make sure to get a high quality one that's really absorbable, otherwise it doesn't really work. You can do mega doses of curcumin. In general, we like to do combination therapy. Instead of high dose of anything, we use multiples of other things to get a synergistic effect. So we normally just do 500 milligrams twice a day with a curcumin. Next thing under that is fish oil. So in order for fish oil to work, it's got to be a high quality supplement. It's actually got to be the oil. I've made a separate video on fish oil, so I won't go over it. You can look it up on my channel to go over the details of it. Fish oil is critically important because one of the things that actually causes high blood pressure is the body making arachidonic acid and inflammation from not having enough fish oil. So in the standard American diet of eating too many inflammatory fats, what happens is your body makes more and more arachidonic acid, and arachidonic acid is inflammatory. In the presence of arachidonic acid, without fish oil, you make inflammatory components and you're unable to turn off inflammation. Your body needs fish oil in order to displace some of that arachidonic acid, and then your body can actually use the fish oils as anti-inflammation. So without fish oil, you will be in a more inflammatory environment, and those inflammatory hormones that come from the arachidonic acid actually directly cause high blood pressure. They're called prostaglandins. Next on the list is stress and adrenals. That's another really big one because, as we talked about in the first video, the adrenals are responsible for releasing cortisol. They're also responsible for releasing adrenaline. Without adrenaline, without cortisol, you have deathly low blood pressure. So it makes sense that if these are on overdrive all day long because of too much coffee, too much stress, too much family stuff, finances, whatnot, then if this is in overdrive, it's driving the blood pressure higher and higher and higher. So if you're not doing anything to manage your stress, chances are you're stressed out whether you realize it or not. I see a lot of executive CEO, high-end guys out there, and there's some girls, but typically the guys are the ones that are telling me, no, I'm not stressed, I feel fine. But they are totally stressed out to the max. Their mood and their brain may not be suffering the consequences of their stress, but their blood pressure and vascular system is suffering. The old saying that something's got to give is true, so you can't live a high-powered, stressful life and not have something go wrong. So if you're not doing something every day or at least every week to take care of your body, reduce your stress, then it's taking over you. That's enough on that. I've got plenty of other videos on adrenal and stress that you can look up. Number 6 is sleep apnea and poor sleep. This is a big deal in America. If you are overweight or have a thick neck or snore loudly, then you most likely have sleep apnea. There's a either cheap or free app on the phone that you can download called Snore Lab. You download Snore Lab, you plug it in, you put it by your pillow, and it records your sleeping, and it can tell you how loudly you're snoring. And the idea is the louder you snore, the more likely you have apnea. It can actually record some of your breathing episodes or all your breathing episodes in order to find out if you do actually stop breathing. But if you have sleep apnea, that's pretty much like you're suffocating yourself intermittently throughout the night while you're sleeping. If you've ever had a Fitbit or any Oura Ring or Apple Watch or anything to track your sleep overnight, track your heart rate overnight, you will notice that your heart rate is supposed to drop overnight by like 12 or 2 a.m. and then it starts to rise back up in order to wake up. But if you have sleep apnea, that intermittent suffocation prevents your heart rate from dropping, and you actually become what we call a non-dipper. So not only does your heart rate not dip, but your blood pressure doesn't dip. That's just not tracked by the Fitbit. If your heart rate is not dipping, your blood pressure is not dipping. On average, if your blood pressure is not dipping, then your total daily average is actually rising. And one of the things we talked about in the last video is as you strengthen arteries, just like biceps, as you strengthen them, they get stronger. So if you're not dipping overnight, then that artery is actually getting stronger, so it will pump even harder during the daytime and raise the blood pressure. So one of the big contributors to high blood pressure is the silent sleep apnea. So many people have sleep apnea and don't even know it. Nowadays, there's companies that will do a sleep apnea test at home. You don't even have to go to a lab. They'll ship you a device, you wear it at night 2 or 3 nights, and then you ship it back, and they send you the results and tell you whether you have sleep apnea, how bad it is. Now, obviously, it's not as good as doing an in-lab sleep study, but it's at least a good screening test to tell you if you have a problem or not, and then you and your doctor can decide if you want to go further. Most guys and gals aren't willing to do the CPAP machine, but it's a big deal to reduce your sleep apnea. So lose weight, do a dental device, see one of the dentists that can make a custom fit dental device to try to push your jaw forward a little bit in order to open up that airway and stop having sleep apnea. So sleep apnea, we could talk about a whole lot more, but it is one of the critical reasons to have high blood pressure. I will lump in poor sleep in there because that goes back to adrenals. If you're not sleeping well, if you're too stressed during the daytime, if too much is going on during the daytime, or you're not spending enough time in the bed, if you're not sleeping enough, remember that dipping isn't happening overnight because you're just not spending enough time in the bed, so naturally your blood pressure is going to rise. You have two systems in your body, sympathetic, parasympathetic. We talked somewhat about that in the first video. The sympathetic is your fight or flight system. Your parasympathetic is your rest and digest. If you're only stimulating one, it's going to get unbalanced. So everyone in America is stimulating the sympathetic system. Got to get coffee, got to go to work, got to do this, got to do it, and constantly stressing themselves out. So if you're not doing something to restore that balance, you are imbalanced. And while you may not have had high blood pressure until you hit 40 or 50, it's not because you did anything different at 40 or 50. It's that you've been stressing chronically for decades and it finally caught up to you. Enough on that topic. The next two are going to be pretty brief. Exercise is an important one. Exercise, in regards to this artery, one of the things the artery wants to do is it wants to pump hard, but it also wants to relax. So when you're doing exercise, you're teaching that artery what stimulation looks like, what being strong looks like, but then you're stopping and recovering and allowing that artery to stretch back out and relax and, yes, deliver more blood at a passive rate. So without exercise, your blood pressure levels start to go up. So one of the ways to reduce blood pressure is exercise. Now, there's a little asterisk there because when you exercise, your blood pressure actually increases, but the idea is overall, as your body gets healthier and as you exercise, you will reduce the blood pressure. I want you to make sure you're focusing on HIIT, high intensity interval training, because if you are not getting out of breath, if you are not getting your heart rate up, if you're not pushing that blood pressure, you're not getting the benefits. So yes, walking, doing anything that gets you moving is awesome, but if you're really trying to lower blood pressure, then you really have to get out there and put some intensity to it at least 3 times a week. A good way to think about it is you need at least 30 minutes of hard aerobic activity 3 or 4 times a week. What hard aerobic activity means is you should not be able to sing a song while you're exercising. If you can easily carry a tune while you're exercising, you are not pushing hard enough. You need to be breathing heavier. Lastly on the list, and it is really last in my list, is salt. And if you can see, I put some question marks behind salt. And the reason why is because salt has been demonized in America as the leading cause of high blood pressure and heart attacks and all this stuff, and it is totally false. The majority of people, 75% of people, are not salt sensitive. Your kidneys are amazing salt regulators. They're so good at regulating salt that if you eat more, they just dump more. If you eat less, they retain more. So if you enjoy salt, salt your food. Don't go too restrictive. I've got at least one patient that struggles with low sodium levels, low salt levels, because he's been restricting salt for so long that he doesn't even like salting his food. So we actually have to do salt capsules in order to boost his levels up. So don't worry too much about reducing salt in order to reduce the blood pressure because the kidneys will do it for you. Now, some people, 25% of the people out there are sensitive to salt, but that's an easy test to run. Take your diet and reduce your salt for 2, 3, maybe 4 weeks and watch your blood pressure. If it's reducing, by all means, keep going. But if it's not, then don't waste your time. Salt tastes good. I like salt. It helps you eat more vegetables to eat salt. So don't be too scared of salt. Run your own test. Once you're done with that low sodium test, low salt test, if your blood pressure didn't drop, then do the opposite. Go a little overboard on the salt for the next 4 weeks and see if your blood pressure starts to rise inappropriately or if you get swelling down your legs or any signs of fluid overload. Most people are not salt sensitive. That is not the way to reduce your blood pressure. If you have high blood pressure, you have some other problem. Just to remind you from the last video, over 140 is considered high blood pressure and over 160 is really high and needs to be treated. There's some talk of reducing the blood pressure rates or amounts to 130, but I still subscribe to kind of the old 140. In general, if you are athletic and healthy, your blood pressure top numbers, systolic, should be around 115. So while 140 is considered high blood pressure, certainly 130s is not normal. 120s can even be considered a little abnormal. You really want to be under 120 if you are ideally healthy. Now, I'm not suggesting you use blood pressure medication to get to those goals. I only use blood pressure medication to get people below 140. If you want to get any lower than 140, then it's up to you to reduce inflammation and figure out your causes. So that is a lengthy description of how to naturally reduce your blood pressure. There's a lot of things you can do. Feel free to ask any questions on anything specific that you may have. Hopefully this video helps you reduce your blood pressure. If it does, let me know what worked for you.